5 things you need to know about a facelift before you have one. 1. What areas of the face are addressed? The classic facelift addresses the neck, the jowls, and the nasolabial fold, not the eyelids, not the brow or the forehead. 2. Face versus neck. What is the difference between a neck lift and a facelift? A neck lift by itself, I only do on young people less than typically 40 years of age. In this I use liposuction and maybe an open incision to adjust the muscle and the deep fat. The reason that on an older person that is 50 or older, a neck lift will not work is because of the condition of the skin. The skin has been stretched and aged so that it will hang if you just do the liposuction. So one needs to excise the skin and add the facelift characteristics, which is a skin excision. 3. Longevity. How long does a facelift last? Till you die, for as long as you live. However, you will continue to age. So for example, if you have a facelift at 50 years of age and you look 10 years younger, then in 10 years you become 60, you don't look 60, you look 50. But you will continue to age unless you have another one which will set you back earlier or younger. 4. Recovery. In my practice, most people go back to work if it's a desk job, but between 1 to 2 weeks and probably average 10 days. The first week, they usually stay out of work because they need to wear a constrictive garment. The second week, the constrictive garment can be worn only at night if feasible. And so most of them go back 10 to 14 days at work. 5. Choosing a surgeon. There's a trick to choosing a surgeon to do a facelift for qualifications. Any surgeon or doctor, medical doctor who has an MD degree legally can do a facelift in his office. But in the hospital, he has to be credentialed, which means that he has to provide to the hospital his training, his credentials, his experience, and the hospital will evaluate whether he's qualified to do this and give him thus the privileges. So if your surgeon says he can do it in the hospital, then he's probably qualified. But if he says he can only do it in a surgery center, then I would question his qualifications. So these are the 5 things you need to know before you do a facelift.